Thank you for the invitation. And the topic I'm going to talk about today is HIFU and myoma. Thank you, the chairman, for a kind introduction. I make no disclosure of conflict of interest. The surgical treatment of fibroid nowadays is mainly myomectomy and hysterectomy. Laparoscopic myomectomy is popular, yet they are not without risk because of bleeding and suturing, and sometimes for large fibroid that may be malignant, then we may disseminate the fibroids. Now, what I'm going to introduce today is the high-intensity focused ultrasound surgery we call HIFU. It's a new surgical direction. It's not something that will win a Nobel Prize that changed medicine. It's just a thermal ablation of the lesion. Here is the fibroid. It burned the fibroid and destroyed it. Now, it is a different surgery. It's focused ultrasound surgery, require no sharp scalpel or scissor. There's no bleeding, and it preserves the uterus, and the patient can recover very quickly after surgery. The focused ultrasound surgery redefined the experience for the patient and the doctors. And the doctor, by the click of a mouse, and this can perform the surgery with ease. There's no blood lost and no knife and scissor. Can't see any hand tremor, but at the click of our mouse. And the patient remains sedated and conscious during surgery. There's no bleeding, no wound, only minimal pain, and the organ is being preserved. She will have a rapid recovery and can go home after day surgery. Unlike traditional theater, this is the theater we used to see, and with all the instrument operating light, with the recovery room, but you can see the difference is the traditional theater need more space and places for instrument. For example, the theater require quite a lot of instrument, a lot of staff, and the difference are obvious. With the HIFU theater, any room can accommodate the surgery. And the patient is awake and can talk to the nurse, enjoy every moment of the surgery. It's the operating room environment in HIFU surgery. The doctor just operating the computer console, and the patient can lie there, can have the chance to talk to the mother or the husband or the friend, and they are awake. Now, this is my theater for HIFU surgery as a day surgery in Hong Kong. It opened in September 2019. The design of the theater have been reported in the Journal of Gynecology and Minimally Invasive Therapy in 2020. Now, you can see the energy by the focused ultrasound in this machine. It can burn the plastic, but however, when you put your hand in between the machine and the plastic, it won't hurt your hand because the temperature is not high. But at the focus point, it can reach up to 90 to 100 degrees centigrade. So at this point, all the cells will die and the heat will conduct it to the surrounding area. However, far away, a few centimeters away, the temperature already could be dropped to just 30, 40 degrees. So it won't hurt when you put your hand in between the machine and the plastic or the lesion you are going to burn. So the skin and the bladder and everything in between is quite safe. Now, the patient who receive operation just lie on the bed. The transducer that offer the ultrasound will burn the lesion point by point. So this will reach 100 degrees and it's quite accurate. And then after you burn one layer, you burn the other layer, just like this. So until the whole fibroids are being burned. Now, this is how it works under ultrasound guidance. You can see that this is the focus point. And the ultrasound is now looking at the uterus, the fibroids in between, and assuming this is a fibroid tumor. The principle is divided the fibroid into various layers. We started at the center layer and then spread it to the outside layers, one layer after the other layer. So when you ablate the whole layer and then you move on, so you can see, you can turn the ultrasound into one layer and the other layer. When you press the button, the ultrasound energy will burn at this area. Now, how can we know that we are already burning the fibroids? And you can see the tumor-induced necrosis by having grayscale changes or white patches, just like that. You can see it change white within the lesion. Then you know you are achieving your task of burning the fibroid. Now, how can we assess that we have completely burned the fibroid or by just looking at this is inaccurate? So what we are going to do is to introduce so-called microbubble. That is contrast of the ultrasound contrast. So when we infuse it intravenously into the patient, and you can see the bubble filling the whole uterus. However, after the treatment, this is after the treatment, the fibroid will not show any bubble. There's only the endometrium, which is intact, you can see. So in this way, we can compare the areas of the fibroid layer by layer, how much is being burned or ablated. And the treatment, previous study have shown, multi-center study have been reported in British Journal ONG, and it showed that the operation is safe and effective, afford speedy recovery. And also for the short-term outcome compared to conventional surgery, it seems to be better. And there's other benefit, for example, the immune response that suppress further fibroid formation, and also the sexual activity is do not affect it after surgery. And the surgeries have been reported to be effective and safe. The result of our study in the first 100 patients showed that we got good result in reduction of the size, reduction of the heavy period, and the pressure symptoms is totally reduced, and the failure rate is 5% in our 100 cases. That means we can't do the surgery. Compared to conventional surgery, the use focused ultrasound, there's no wound, and the treatment time is only 1 or 2 hours compared to the longer time in conventional surgery. There's no blood loss, and the risk of infection quite rare. The recovery day is less than 7 days, and the sick leave is shorter. Doesn't affect the fertility. Now, we are happy to have so-called HIFU baby, a baby after treatment of fibroid, and can have a baby after 3 months. We save a lot of uterus being removed from a hysterectomy. So for the first 1.5 years, we have already done 200 cases. So for anyone interested in this topic, I would like to introduce my book on this area. You can find this book from this website from Springer, or contact me. You're welcome. Thank you.